How are you
Hello.
this
I'm
afternoon?
doing all right. How are you?
That's good. I'm pretty good. Are you ready to get started?
I think so.
All right. So, first we just have some basic information that we have to go over,
Okay.
which is common for our first session. So, let's start off with an easy one. Where do you live?
Okay. Not so easy because I'm in college. But currently, I live at Bay Path University. I'm a resident student there. I live with one roommate. Her name is Jensen. When I'm not at school, I live with my parents. I live in Huntington, Massachusetts, which is in the Berkshires of Massachusetts. Yeah, and I live there with my mom, my dad, and my two sisters.
Very nice.
Yeah.
Can you tell me about what your family is like and who you consider part of your family?
Okay, so in my immediate family, like I said, I have my mom and my dad and my two sisters. My dad is a paramedic, deputy chief of a fire department in the area, and then my mom is a nurse. And then my two sisters, one is in college, she's a freshman at LaSalle University. No, LaSalle College. I always want to say university. And then my other sister is a sophomore at Gateway Regional High School.
Okay.
And then, outside of that, that's the immediate family. Outside of that, who I consider family and is really immediate is my grandmother. She also lives in town. My uncle, also my dad's brother, and my grandmother, my dad's mom. They both live in town also. And then my mom's parents live relatively close. And it's kind of the group of us all in it together.
Okay. Do you have any parental obligations? Meaning, do you have anybody who looks at you as a parent figure?
Well, I don't have any kids personally myself, but I have a younger sister. She's 15 years old now. But when I was, 13, 14 years old, that made her 7. Yeah. My parents were struggling financially really hard, and they were working. My dad was working about 100 hours a week, and my mom working about 70 hours. And my parents, being nurses and paramedics, don't work 9 to 5, so they were always gone. And I really had to raise both of my sisters, but the youngest one in particular, cooking, helping her with her homework, cooking for my sisters, and really helping them get ready for bed and putting them to bed and checking their homework and making sure to leave out permission slips for them to get signed, and really taking care of them. And still to this day, my youngest sister, the 15-year-old, she doesn't listen to my parents. Definitely whenever something needs to be for her to get something done, I'm always called, like, hey, can you talk to her? Can you, get her to do this? Can you get her to do that? Because out of the family, she's the closest with me, and I'm closest with her too. Everything I do is for her. But she looks up to me, and I really gotta, everything I do is for her. And it's because I kind of raised her for a little bit there, and still do.
Okay. Is there a history of substance abuse in your family?
Out of my parents, no, but I have a family history of alcoholism. My dad's father was an alcoholic, and on top of everything else he had going on, it really contributed to him dying at a very young age.
Okay. Can you tell me a little bit about your family's medical history?
Yeah, so, except for my dad's father, my dad's side has lived a very long age. The only thing we really have on that side of the family is we have a family history of heart disease and liver disease, but the liver disease is because of the alcoholism that runs in the family. Otherwise, that side's very healthy. I have a great-grandmother on that side who's 98. She's doing fantastic. But my mom's side has a lot more of the health problems. So on my mom's side, we have a family history of high blood pressure, high cholesterol, heart disease, heart attack, lots of cancer, any type of cancer. Also thyroid problems, whether it's hypothyroidism or hyperthyroidism. I'm trying to think what else. Family history of asthma and seasonal allergies too on that side.
Okay. Can you tell me a little bit about your family's mental health history?
Yeah, you know, for a while there, mental health wasn't something we really talked about. But recently, and this is, you know, part of the mental health history, recently my grandfather was diagnosed with dementia on my mom's side. And my mom has some untreated depression, anxiety, possible bipolarism, or however you pronounce it. It's untreated and really undiagnosed, which is unfortunate because that would really help me figure out what I struggle with. But because she refuses treatment and refuses to go get seen by someone, we don't have it. My dad's side, they're very the old Polish, Irish, like, we don't talk about feelings type of side. So, but to my understanding, there's no mental health illness history on that side.
Yep. All right. Can you tell me about your friend group?
Mm-hmm. I have a very wide range of friends, which is awesome. But I have friends from everywhere. I don't really talk to my friends from high school that much, although just because we kind of went our separate ways. We still talk, but, you know, our separate ways since high school. But I have lots of friends here. I live with my best friend. My best friend's my roommate, so I'm really lucky on that one. And I have friends. From the different things I do on campus. I also have some of the people I ski with. I work at a ski area, and they are some of my closest friends. And it's just funny because I have friends, you know, my age from school or whatever, and then from work, and then I have friends who are my parents' age because of where I work at the ski area. You know, I am the youngest they have, so it's a very wide range of friends, but I'm very lucky to have them in my life. They're very supportive of me.
All right. Do you have any serious relationships that you're involved in, like significant others?
I don't have any. Well, I have some, you know, very serious. Like, I have some serious friendships that, like, I mean, best friend wouldn't even describe them, and I consider those, you know, serious relationships. But I don't have any significant others in my life, and I don't really have any past significant others either. I've just kind of got my friends and my family, and I focus on school.
Okay. Are you a part of any community groups?
Yeah, definitely. I'm heavily involved. So, like, outside of my schooling, I work, like I might have mentioned, I'm at a ski area, and that's a very important group of my life. I, you know, belong to the National Ski Patrol. We go to these conferences across the country every year, and I really have a sense of identity with that. Also, you know, in the performing arts too, working as a singer, musician-ish. Not giving myself too much credit here, but definitely, like, with those. And, you know, I volunteer a lot and do a lot of work outside of the school and the community, volunteering for, like, the American Cancer Society. I volunteer to help teach CPR to high schoolers, just kind of getting outside of the school as much as possible. It's kind of hard to be like, yeah, this group, but I got a resume, I can send it to you.
Do you have any previous or current court involvement?
Well, I've personally never been arrested. I've never been pulled over. I'm pretty much on that straight and narrow path, if you couldn't tell by now. But I have had to testify in court because of a patient before. Because I work at a opioid addiction clinic, and so I've had to testify because of cases there.
Okay. So you mentioned that you're in school, so that's your highest level of education?
Yep, I guess since I'm a senior, I've earned my associate's degree. I have like 116 credits, so like I'm right there to graduation. But yes, I am a medical science concentration in pre-physician's assistant studies major with a second major in neuroscience. And because I really don't like free time, I'm also a minor in the performing arts. Wow. So 2/3 of my time is spent with science and 1/3 spent with performing arts. And I couldn't be happier about that.
Do you have any learning or developmental disabilities?
Yep. let's see. Yeah, developmental. What do you mean by developmental? Like,
Like when you were a kid in school, did you ever get help for any developmental?
no, but I did a sport I was a in high intensity gymnast. So I didn't go through. I competed for 2 gymnastics teams at once, competing 3 meets a week, training 6 days a week. So I didn't go through puberty until I was about 18 years old, only because of how much I was training. So development, I don't know if that counts, but that would be like the only developmental thing. For learning disabilities, I actually have 2 learning disabilities. First, I don't know how it's classified, but I'm missing a connection between, mine is centered all in English and reading and writing and and language. So for me, one part of my learning disability is I physically cannot write sometimes. Like there's some connection missing between my hand and my head, and I can't write. And also I am diagnosed with moderate dyslexia. So yeah, combined, I have a great time in class.
So earlier you mentioned working at a clinic.
Mm-hmm.
Do you have any other jobs?
Yes, I have many, many jobs. So first, I work as a nanny. I nanny for an 11-year-old girl. She's the sweetest thing. I get her ready for school in the mornings, bring her to school, pick up other kids in her carpool, totally do the whole soccer mom thing. I love every second of it. I mentioned before I work at a ski area. I'm actually a volunteer, so I volunteer as a ski patroller at the Blandford ski area. I've been doing that for many years now. I work at Bay Path University as a student information desk representative. And as I mentioned, I work at a clinic. I work at an urgent care and clinic, which has a healthy living program in it, which basically treats opioid addicts with this product called Suboxone. I'm a medical scribe and assistant there. So we treat broken bones and go help with the opioid epidemic, all depending on which side of the hallway I'm on. It's fantastic. I love it.
Do you participate in any activities that you would consider meaningful?
Yes. I'm a singer. I love singing. Anything to do with singing, music, performing arts is very meaningful to me. It's definitely helped me find my voice. Also with skiing is very meaningful to me. I've developed what I want to do with my life, and I've made these lifelong friendships, and that's where it originally shaped who I am as a person. Also, running. I love running. It helps me clear my head. Working out in general does. And just kind of being with friends and family is also really meaningful to me. I'm definitely a family-oriented and friend-oriented person. So getting to spend time with them is very meaningful.
So you're working. So
Mm-hmm.
is that your main source of income?
Yep. I work many jobs to try and support myself.
Do you receive any assistance?
I received some assistance through the government to go to school. Like most people do, fill out the FAFSA. It takes forever, and it's the long, complicated process, and then you get gypped aid. So I deal with that. I get that every year. But otherwise, I don't receive any assistance. I mean, my parents do. I'm still on their cell phone bill and their health insurance, holding out for as long as possible with that one. But otherwise, I support myself with paying for school, car insurance, car payments, and anything else I might need.
Okay. Do you have anybody who you would consider dependent on you?
Financially?
Yeah.
Financially dependent. No, thank God. I just support myself, which is hard enough to do as it is.
Okay. Did you ever serve in the military?
No, I've never served in the military. I considered it, but I wanted to get my physician's assisting master's degree first before I enlisted.
Did you ever live with anybody who was currently serving in the military?
No. I mean, my dad's a firefighter, so I consider it kind of similar, military, fire, police. I have a police chief and a deputy chief of fire in my family. So,
Okay.
But actual military, no.
Do you use any substances such as drugs or alcohol?
I do not use drugs at all, but I do drink alcohol. Probably a drink or two, maybe 3 a week, depending. Not. I try to be very careful because of my family history, so
Okay.
I limit myself.
Have you noticed any behaviors in yourself that you consider addictive?
No, I don't have any addictive behaviors in myself, but like I've mentioned before, I have a family history of alcoholism, so I'm very careful about how much I drink and should, because that's a type of addiction, so I really try and keep myself in check on things, whether it's with alcohol, with pizza, whatever, TV shows, to try and really keep myself grounded.
Okay. Have you ever been in counseling before?
I have not. This is something my friends have said I needed to do for a long time now, so I really need to stick with it and really take care of my mental health.
Okay. Are you up to date with all of your medical exams?
I'm definitely not up to date with my medical exams. I haven't been to my primary care doctor in about 2 years, and I have never seen an OBGYN. I'm up to date with all of my vaccines, so I have to. I don't have tuberculosis. I just got a TB test a couple months ago. Stuff like that, I'm all up to date with. Need to get my flu shot next week, but so good, but slacking in some aspects too.
Okay. Are you currently taking any medications?
Yep. Currently, I take Claritin every day. Claritin or Zyrtec, depending what I have more of at the time. So I take that every day for seasonal allergies. I take Sudafed semi-regularly, because I have a drainage problems, and being a singer, my ears block up. So I take that regularly to try and kind of drain everything out. I take Valtrex to prevent cold sores, because I get cold sores on my lips really badly. So if I don't take Valtrex, it's ugly looking. Is that everything? I have an EpiPen because I'm allergic to bees, but I obviously don't use that every day. So that's just in case. But it is a prescription medication and prescription toothpaste.
Nice.
Yes.
All right. Do you have a history of trauma? This could include any kind of abuse, any kind of neglect, any situation that you've been in that you consider traumatic.
Well, I work in the medical field, so we see a lot of patients that to the normal person would be considered traumatic. But I definitely am good at kind of keeping that locked away, which is probably not healthy, but it's a good coping mechanism for me to just kind of compartmentalize that. Some things I can think of, like traumatic events. Saw a kid get hit by a car once, and he went flying. That was a little traumatic. Also, my mother, love her dearly, but would take a lot of her frustration and anger out on me. So definitely have some memories growing up that weren't so pleasant, from her yelling at me and kind of, telling me I was worthless and wasn't going to amount to anything, and that I was a disgrace to the family. The usual for that type of a deal, but I would take it because I'd rather take it than have my younger sisters. And luckily she never gave it to them, so I could take it all.
And now for the last thing, can you tell me what some strengths that you think you have are?
Strengths. Okay, let me see. Well, I'm a really hard worker. I definitely work very hard because I have to, especially in school, having a learning disability, I've really had to, work extra hard compared to other people because, I have to. My brain's fighting against me. So I'm very hard worker when it comes to that, and not just in school, like in general. I work very hard at all of my jobs, and I definitely want to succeed in life, and I feel like that has to do with hard work first. Also, hard work. I'm very supportive. I like to be very supportive of my friends and family, listening to them, being there for them, making sure I get to everyone's birthday parties and making sure everyone's doing okay. I know that's a strength, but it's also a weakness of mine because I always put myself last because of that. But I would consider it a strength, to put everyone before me and to really help raise them up. Because once they get up there, they can kind of put a hand down and help me up. Hardworking, there for everyone. Let me see what else. Very determined. I like to prove people wrong. I want to succeed in life. I'm very determined to prove everyone wrong and do things I'm not supposed to do because of whatever, like learning disabilities or something. And I'm proud of the role model I am for my sister. I think that's a strength of mine, is being that person she can look up to and kind of be like, I want to be like her one day. Yeah, those are, I'm sure there's maybe more, but on your weaknesses I could talk forever, but I'll just leave the strengths there.
All right. Well, it's been nice to meet you.
Nice to meet you. Thank
you for coming in today.
Absolutely.
All right.